There's a huge need for research around e-cigarettes, because if they are going to become the fantastic opportunity which we think they are, we need to have evidence to be able to back that up. We need to be able to tell patients, look, this is how you use them, maybe you need this kind of support, maybe this kind of model of e-cigarette. We don't know so much about the details. We know the principle. The principle is that e-cigarettes will almost certainly help you stop, but we want to get people the right evidence so they can make informed decisions.
I'd really like to see more research into harm reversal. There have been some small studies that show that people who have started vaping actually have their health improved, even if they're people who've smoked for decades and have got, very poor lung function, for instance. And the people that we see in our service in Leicester City have told us that they feel a lot better, just like anybody else who has stopped smoking would. They can breathe better, they can move more easily. People who already have COPD have found that they can reduce the number of meds that they take, and I think that's a real success story. So I'd like to see more on that, so that it becomes more than just anecdotal evidence, that we can demonstrate that this is an observed effect and give clinicians more confidence in recommending this to their patients.
One aspect would be regarding the e-cigarettes and their effect on the respiratory system, the pulmonary system. So see whether we can actually do something along those lines and have more robust data. And when I'm talking about effect, it could be either positive or negative, and I suspect that what we have at the moment evidence, it will be a positive effect on the respiratory functionality of people using e-cigarettes and who have moved from smoking. I think it will be a positive effect, but if we can prove it with the best evidence base, then that will be a brilliant tool for GPs to advise.
I think we need longer term studies on the safety and efficacy of e-cigarettes for smoking cessation, and in fact there are a number of those studies underway now. I think we also need really good research with priority groups, so pregnant women, people with long-standing mental health conditions, crucially, people in lower, less affluent communities, or people in settings, for example, where they can't smoke, so when they need to stop smoking in hospital or other settings. So I think those are really important areas for research. Encouragingly, Cancer Research UK and other funders are funding a lot of studies in the UK, so we will see new evidence emerging all the time.